With cases rising across the country, more attention is being paid to the global race for a COVID-19 vaccine. We just heard the update from BC to that effect, insofar as they've seen today 139 new cases, and that's a single-day record in that province. The race for that vaccine had a setback this week, though, when the leading vaccine candidate halted its phase 3 trial after a participant suffered a severe adverse reaction, is how it's being termed. Astrazeneca is now investigating exactly what happened. There are also concerns about vaccine nationalism, meaning whichever country does develop a vaccine first might hoard the needles and prevent other countries from accessing them. Is that a real risk, and how worried should we be about the paused trial? To dig more into that, I'm joined by Dr. Ezekiel Emanuel. He previously served as a health policy advisor to President Barack Obama, and he's the new author of the new book, Which Country Has the World's Best Healthcare? He joins me from Washington. Hi, Dr. Emanuel. Pleasure to welcome you to our program.
Good to be here with you.
I have some more kind of general questions for you about when a vaccine is eventually successful, how it gets distributed. But I wanted to start off on what's been kind of dominating the headlines in the past few days, and that's the halt to the process with Astrazeneca. And I wonder, from your perspective, is what you're seeing abnormal at all, or is it something along the lines of what you would have expected in this process?
No, this is exactly the way it should go, which is you have a serious adverse event. You halt the process. You try to find out if this is caused by the vaccine or it's unrelated. And you don't put any more people at risk than you've already vaccinated. You follow everyone who you've vaccinated. That's exactly what should be happening. And that appears to be exactly the process that's being followed now.
So no cause for concern from your viewpoint at this point?
Well, there is cause for concern because you worry that this very serious adverse event might be caused by the vaccine. We don't know for sure, but if it is, that does create lots of anxiety and safety concerns.
In conjunction, I consume American news oftentimes in the morning, and in conjunction with this story, often us on this side of the border hear headlines or announcements from members of the White House administration on your side of the border saying that there is going to be a vaccine by the end of the year. I'm wondering if you can help us sort of dig into that and how realistic you think that possibility is.
Before the end of the year, maybe. Let's just remember what we've got with actually these early vaccines. First of all of them require 2 shots separated by 3 to 4 weeks. So you got to give a shot, you got to come back 3 to 4 weeks later, give another shot, and then that person has to be exposed to the coronavirus and develop a serious illness, which takes time itself. And we need a number of those events to happen. Getting it before the end of the year is possible, but there's no slam dunk. As we can see with the Astrazeneca event, nature takes over. We don't know how much these people are going to be exposed to the coronavirus, how many of them are going to actually come down. They're going to be advised to be cautious, and that also will reduce their exposure. So it's a matter of nature. It's not a matter that human beings control. And so, yes, it's possible before the end of the year. But having a vaccine is different than having lots of people in the public vaccinated. Those are 2 different things. There's a long gap there that needs to be filled in.
Okay, actually, let's dig into that gap and sort of some of the things that you would highlight which have to take place in that interim period.
Yeah, well, part of what you need glass vials to put the vaccine in. You need what's called fill finish, super sterile facilities where you actually put the vaccine in to the glass and bottle it up. Some of these vaccines will require cold chain, minus 70, minus 80 degrees centigrade or minus 20 degrees centigrade. You then need needles and syringes. You need to prioritize who's going to get the first tranche of vaccine because there's not going to be enough for everyone, even in a country of Canada size, only 32 million people. And then you need people to go out and vaccinate and record who they vaccinated with which vaccine, if there happens to be more than one, and so that those people will come back and get the right second vaccine. None of that is trivial. If we're going to vaccinate in the United States, we're looking at, 250, 300 million people. That's a big logistical challenge that needs at each stage of the process. There could be a bottleneck that will slow things down. By the time you manufacture, put it into glass vials sterilely, send it out, get needles and syringes, give it to people, give a second dose to people. That's a long time. It's not overnight.
When it comes to the question of who gets it, right, beyond all the sort of questions around like having the right equipment to distribute it, but those bigger kind of ethical questions, the head of our immunity task force, Dr. Naylor, who's kind of a well-known name in this country, came on this program and said, this is going to be one of the biggest questions that the federal government in this country faces, like a big ethical question. Who do you give this to first, if in fact supplies, as they likely will be, are limited, at least over a certain duration of time? What are your thoughts on those ethical questions and how the vaccine should be distributed?
Well, once you have a vaccine in a country, then it's a in-country issue. And the main goal, I would think, initially, is to make sure that premature deaths are reduced. I think that's the goal you want to achieve. And that requires figuring out how it's best to protect people. We in the United States, we have a National Academy of Medicine's report, and they're going out and, in their top category are healthcare workers, and then people who have, they're looking at elderly, they're looking at people with two comorbid health problems like obesity and diabetes, or heart disease and emphysema, who are at high risk for getting COVID, and more importantly for having serious complications from it and dying. Now, maybe that's the right group, but healthcare workers, they're pretty much protected now at places that have good PPE, because donning and doffing and wearing a mask and having the gown and gloves, at least at my institution, almost zero transmission from patient to doctors, not that big a deal. So whether they should get it is a big question. Think about how are you going to confirm that people with two comorbid diseases, and that they should be at the top of the list. That is a big challenge. What are they going to come in with their insulin and their hypertension medication for you? So figuring out who they are and getting the vaccine to them is not going to be easy. It's much easier if what you say is, all right, we've got age cutoffs, because then it's simply, look at the driver's license or some such. So these are big, they're big ethical challenges. And again, part of what we want to do is keep the premature mortality down. But part of them are also going to be simultaneously logistical challenges.
I wanted to jump off your answer and just ask you about not just the distribution within a country, but globally, and how you envision that process taking place, especially with such sort of nationalist sentiment. And I know it's easy to sort of prescribe that where the U.S. is concerned, but we are seeing it all over the world, really. This pandemic has forced people to kind of look inside their own borders and want to take care of their own. How do you kind of acknowledge that while at the same time making sure those underdeveloped or developing countries get the help they need too?
Yes. So I think you're right. Vaccine nationalism is not just a trait in the United States. Some of your viewers may remember when Sanofi, the French drug company, said, if we develop a vaccine, the first doses are going to the United States. And all of France erupted in outrage at this. And, this is a French company. The vaccine has to stay in France. So this is a common problem. But we also need to be clear, without a world government where country governments are responsible for the freedom, protecting the freedom and protecting the well-being of their citizens, some nationalism is very much acceptable. Prioritizing your citizens has an ethical claim. It's not simply an unethical behavior in this world situation. But as a group of ethicists and I have argued, nationalism and wanting to provide for your own citizens is not unlimited. There's a cap in a worldwide health problem like the COVID pandemic. And that cap is when you can get the transmission rate down below 1, when you can get a low transmission rate with a vaccine, then you should release the excess vaccine to the world. You should not hoard that vaccine.
Appreciate your time very much, Dr. Emanuel.
We need serious international leadership that has a moral compass, and I think that's what we're lacking at the moment, unfortunately.
Okay, unfortunately, I have to leave it there because I'm out of time, but I do appreciate your time very much.
Thank you very much. A pleasure to be with you.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.